Welcome to Tuesday's edition of COVID-19. Authorities have recorded 75 infections here in Korea today and are calling for heightened caution amid fears of a resurgence in light of the colder temperatures. Accordingly, in today's studio session, we touch upon ways to ensure greater safety amid this new weather factor. We start the program now with our Kwon-soa with the latest numbers on the pandemic. So as always, let's begin here in Korea. Are we linking the decline in cases today to fewer testings?
Not really, Sunny, because we actually had over 13,000 tests conducted on Monday, which is around double the amount of the day before. But nevertheless, we do see a decline in COVID-19 cases this Tuesday. We are at 75 today, and 46 were domestic infections, with a rise in imported cases. So with the domestic figure being below 50, the coronavirus situation is meeting the criteria for level 1 social distancing measures according to the current 3-tier system as well as the upcoming 5-tier system, which our Kim Ji-yeon will go into the details later on. Now, taking a closer look at Tuesday's figures, the total stands now at 26,807. Unfortunately, we have 4 fatalities, and also there are 52 people who are currently in severe or critical condition, so that's a rise by 3 compared to yesterday. Now, although cases have dropped for the second straight day, as we can see here, experts say if any infections occurred during Halloween, which was on the past weekend, the numbers by the end of this week will give us a clearer idea on whether we are really on a downward trend.
I see, so we'll have to wait and see then. Meanwhile, authorities are seeking to expand their preventative screening measures, I hear.
Yes, Sunny. Following wide-scale tests at medical facilities, especially in the metropolitan region, officials are planning to expand these nationwide after consultations with officials in the provinces and cities. Now, some 26,000 people are to be subject to these tests, and screenings that were conducted since mid-October already helped in detecting some 22 patients in advance. And still, most provinces and major cities are being affected, as you can see here. So these massive testings should help in containing the virus. We have 22 in the capital, Seoul today, 27 in Gyeonggi-do province. And again, we also have a rise in imported cases this Tuesday. Out of the 29, 16 were foreigners, and 13 out of these were from the U.S. And with that, let's take a look at the major outbreaks around the world. The U.S., just ahead of the elections, has some 93,000 new cases reported in just a day. But there's also positive news in Brazil, which had less than 10,000 new infections, around 8,500. That's the lowest since the 12th of last month. But France over here, another all-time high, daily high of over 52,500 infections. And moving over to Italy, it has surpassed the total cases of South Africa. And also a concern is the global figure. As of noon Korea time, we have over 508,000 new infections, with a total now at 47.3 million. And those are the updates I have for now, but I'll be back in a bit after the government briefing. Back to Sunny.
All right, so thank you for that. Right, back on the local front, relevant officials announced an overhaul of their social distancing guidelines this past Sunday, now comprising of 5 tiers, which authorities hope will allow for a sustainable fight against the pandemic while ensuring economic stability and public safety. For more on the new measures, which are poised to go into effect on Saturday, I have our Kim Ji-yeon here in the studio. Welcome, Ji-yeon.
Welcome.
Hi. Right, Ji-yeon, what are some of the notable changes?
Well, the current 3-tier system, which comprises of level 1, 2, and 3, will be expanded into 5 categories, namely level 1, 1.5, 2, 2.5, and 3. And the government has divided the nation into 7 zones, with the level of each zone to be determined based on the average number of daily infections over a 1-week period. Now, Prime Minister Chung Se-kyun said the restructuring is aimed at minimizing changes that comes with each social distancing level, saying up until now, changes in the level have created too many disruptions that may have burdened society and businesses.
We are dividing the social distancing rules further from 3 levels into 5 to better reflect reality. We are also redesigning our disease prevention measures to make them more tailored and to make them more effective.
In determining the social distancing level, a different set of criteria will be applied to the Seoul metropolitan area, the most populous city in Korea, where a majority of the country's population reside, and regions outside the capital area. So, for example, the level will be raised from 1 to 1.5 if the number of daily infections in the Seoul metropolitan area rose by 100 and 30 or more in other regions. Level 2 will take effect when the number of cases exceeds 300 nationwide, which is about double that of level 2.5. And if 400 to 500 daily cases are reported, level 2.5 measures will take effect. Level 3 social distancing, which is the highest on the ladder, will be issued nationwide if more than 800 daily infections are recorded.
And hopefully that will not be the case.
Of course.
Cheon, can you give us a further breakdown of the 5 tiers and the changes that they entail in our daily lives?
Right. Well, level 1, which is the current level, signifies a controllable level of transmissions that allow ordinary people to live their lives while wearing masks. And social gatherings and events are allowed as long as authorities are notified in advance of any gatherings of 500 or more people. Under level 1.5, the use of the public use facilities are restricted and gatherings of 100 or more people are banned. At level 2, the outbreak is poised to spread nationwide, and gatherings and entertainment facilities, especially those that are open into the late hours and serve alcohol, are banned. Only takeouts or deliveries are allowed in restaurants after 9 p.m. You know, what's interesting is that under level 2, cinemas and live performance halls will still be allowed to open, but with socially distanced seating arrangements. These are important for people that are going out.
Yeah, of course. Jen, I understand the top 2 levels of the ladder will still call for more stringent measures, though.
Yes, the government will urge the public to stay home if level 2.5 social distancing measures are in effect. Internet cafes and cinemas will not be allowed to stay open after 9 p.m., and religious services will be held online. At level 3, the nation will effectively be under lockdown, where schools will shut down and sporting events will be canceled, and gatherings of 10 or more people are prohibited. You know, what's interesting here is that restaurants and cafes, unlike other countries, will still be allowed to open under level 3, but rigorous distancing measures will apply, with only 1 person allowed per 8 square meters of floor space.
I see. So proper spacing of patrons then. What are health experts saying about these changes?
Well, I asked them, and they're divided, but they see more good in it for the most part. Some say that the measures are aimed at, mitigating the loss of life than stemming the virus itself, reflecting the limitations of applying these stringent measures over a long period of time in consideration of public fatigue. But there are concerns that the measures could be interpreted as the government taking its foot off the pedal at a time when a resurgence of an outbreak is seen as a distant possibility over the fall and winter seasons. If you recall, there was a spike in the number of new infections between the months of May and July this year, linked to the nightlife district of Itaewon, and that occurred while the country was still under level 1 social distancing.
Right.
So we always have to be careful and stick to the basics.
Of course. All right, Cheon, as always, thank you for being with us today.
Thank you.
Right, it's time now to join the regular government briefing on COVID-19 for this Tuesday. As part of preventative measures in light of the Halloween celebrations this past weekend, health officials have urged people who partook in the festivities to get themselves tested should they believe they may have been exposed to the virus. Now, common symptoms include a high fever and a sore throat, and authorities are warning against a complacent and nonchalant attitude, underscoring the danger of secondary infections and more. Also, given the colder temperatures in recent days, more people are seeking shelter, that is, indoors, highlighting the need for regular and proper ventilation, as well as the frequent disinfecting of commonly touched surfaces. Now, we are still waiting for the briefing to commence, and as we wait, let's take another look at the revamped social distancing guidelines here in the country announced by officials this past Sunday. Right. Well, the briefing is about to start now. We'll come back to you afterwards.
설명이 있겠습니다. Let us now begin our regular briefing on the COVID-19 response here in South Korea for November 3rd, Tuesday. As of today midnight, we have 46 new local infections, and the total caseload now stands at 26,807. 115 more people have been discharged, while 1,825 people remain in quarantine. And we have 52 patients with severe or critical conditions, and we had 4 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And let us take a look at the updates on our major domestic infections by region as of noon today. And first, in the metropolitan city of Seoul, we have the Ace Hope Care Center in Seoul's Dongdaemun-gu district. We have 1 additional cases, increasing the total to 14. And in relation to music lesson, we also have 22 people being confirmed in total. And in relation to a health clinic in Songpa-gu district, we have 2 additional cases, increasing the total to 17. And in relation to Lucky Sauna in Gangnam-gu district, we have a total of 38 cases. And in relation to a family in Guro-gu district, we have also 47 cases in total. And also in relation to a middle school and health club, we have 6 additional cases, and a total of 40 have been confirmed to date. And in Yongin City, the golf outing in relation to this, we have 56 cases being confirmed to date. And in relation to the health center in Gumpo City, we have 22 cases being confirmed. And in relation to SRC Rehab Hospital, we have also 2 additional cases. A total of 156 have been confirmed to date. And in Chungcheongnam-do Province, Asan City, we have a workplace where 4 people have been confirmed, and a total of 23 have been confirmed to date. And next, we have some updates on our clinical trial as well as our therapeutic development. And first of all, remdesivir, which is a drug to treat COVID-19. As of today, we also have a total of 729 people being administered with this drug throughout the country. And as for the blood plasma treatment, we have confirmed that 47 people have been administered with this therapy across 6 hospitals. And in relation to the blood plasma treatment development, we also have had numerous rounds of personal donations. And we have had more than 2,700 people showing intentions to donate their blood samples, and out of them, 2,300 have been donating their blood right now. And in the Daegu region, and in relation to a religious group, and they will be beginning to donate their blood massively, and about 4,000 people will donate their blood samples going forward. And we will closely cooperate with the Korea Red Cross and the local government as well. And we would like to thank all of the members of Shincheonji for their donation, and we would also like to thank the cooperation put forth by the Korean Red Cross as well as the Daegu metropolitan city. And the quarantine authorities would also like to note that last Friday we have been carrying out a committee meeting on the support for the quarantine for the vaccines. And in this process, we have many clinical trials that are being carried out, and we have one message in regards to this. And as for the clinical trial project report, there are many institutions which are cooperating, and under this circumstances, all of the heads of these centers need to also agree on the fact that all of these centers agree on and have a consensus on the proposal proposal, or they need to have designate a representative chief who can also propose an agreeable report going forward so that we can have better conditions to carry out clinical trials. And in relation to the live treatment, live quarantine measures, and as for the safety e-report, we have some updates of the reports there. And despite the quarantine authorities' recommendations, we have seen many organizations and many groups having gatherings indoors. And also there were large-scale alumni group meetings at hotel restaurants, and also they gathered in pensions as well. And also we have had some reports where we saw a great exposure to the virus transmissions, and we are seeing similar examples being reported so far. And the quarantine authority would also like to note that as we near into the holiday season, meaning that we can have an increase of the number of social gatherings, we ask you to also take particular precautions when you are going on group hikings, and please minimize the number of participants. And even when you are outdoors, if you cannot keep at least 2 meters of distance, please wear your face mask at all times. But if you feel it's difficult to breathe while you are hiking, please find a place where you can take off your mask and ensure a healthy distance with others. And when you are sharing food with others, please refrain from engaging in dialogue. And as for the eateries, please refrain from sharing dishes or other utensils. And also, please wear your face mask and wash your hands and have ventilation, and also disinfect surfaces. And once again, these quarantine measures need to be highlighted and need to be kept when you go to large-scale social gatherings. And if you have symptoms of suspected symptoms like fever or respiratory symptoms, please get tested as soon as possible. And last but not least, we would like to mention that the COVID-19 situation globally is also spreading not only across the US, Europe, and it is also spreading to the Middle East as well. And this, against such a backdrop, many experts say that this is not a rather second wave. However, they say, and I would like to note that this is a large-scale, a major outbreak, and maybe early to next week, we believe and we expect that the confirmed cases, the global tally could also surpass 50 million. However, on the other hand, these conditions here in South Korea, we are able to contain the virus to a certain extent, and we also have some risk factors, including a massive people moving during the holiday season, and also we have some risks stemming from the hiking meetings, hiking outings. However, we are able to contain the virus to a large extent. However, we do have risk factors and potential that this could lead to a major outbreak. Against such a backdrop, every individual and all of the users to public facilities needs to comply with quarantine measures, and centering around the safety measures and administrative ministries, we are seeing heightened efforts put forth by the members of the public servants, as well as the medical professionals who are exerting their full efforts as well. And we are also able to contain a major outbreak here in South Korea thanks to all these concerted efforts. And the quarantine authority would like to appreciate all of the efforts put forth by each and every one of the individual. However, we are also paying attention to any gray areas of quarantine and whether we need to put in place further policies and measures. We are also monitoring the conditions of a global outbreak, and at the same time, we will also continue to stay alert until we combat the virus fully. Even at this moment, we are also seeing many companies and researchers who are exerting their full efforts to develop a possible COVID-19 vaccine and treatment. And as for the therapeutics, we believe that we will have some visible results and outcome by the end of this year. And we believe that as for vaccines, we will be having a new phase of these development in vaccines starting from the end of this year. And this also calls for many of the help of the patients. And as for the clinical trials for therapeutics, we believe it is very important that we have participation of the patients who have light symptoms, and we will also like to consider this, help you to consider this and ask you to consider this as well going forward. And as we mentioned, we have seen many people who have been treated after the COVID-19 donating their blood samples. And going forward, if you agree to the conditions that are explained by the medical experts, we believe that there are many people who are participating in the clinical trials as well. We thank you once again. And in order to provide more support, the related facilities and related companies, not only the government, are also exerting our full efforts to help these developments going forward. And these developments will be carried out to this end, meaning that until we have another major infectious disease after combating the COVID-19, South Korea shall stand at the initiative, and we shall stand shoulder to shoulder with other advanced countries when it comes to development of therapeutics and vaccines. And we will also exert continued efforts going forward. And we shall have hope until the end and until we fight COVID-19 completely. And we ask you to wear face masks, wash your hands, ventilate the space, and keep social distancing measures as you did right now. And please have endurance going forward as well. Thank you very much.
기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, that was Kwon Junuk, Deputy Director General of the Central Disease Control Headquarters with Tuesday's afternoon briefing. So do give us a summary of what he had to say.
Well, first off, there were another number of new infections related to a number of clusters, especially in the metropolitan region, related to a golf meeting, a music academy, a rehabilitation hospital, a sauna, a care center, and many more among others. So Kwon also mentioned that there have been reports of how people have not been abiding by social distancing measures, especially at social gatherings regarding religious meetings, or also an alumni meeting as well. And he also had some recommendations ahead of many autumn gatherings and many people going out for hiking. Even when outdoors, he called on people to wear masks. It's not safe to be not wearing them even if you're outdoors, because many people are sometimes crowded on those mountains, and refrain from eating together. And if you do have to eat together, do not hold conversations with other people. And he also had a mentioning on the clinical trials regarding vaccine development here in the country, asking for participation of patients who have light symptoms of COVID-19.
I see. All right, so thank you for that. We'll see you again tomorrow.
See you tomorrow.
Right, come December 3rd, that would be exactly a month from now, some 490,000 test takers will be sitting for the College Scholastic Ability Test, which was originally supposed to take place later this month. Authorities are working to ensure a safe testing environment as students kick off their final test preparations. To take a look.
The COVID-19 pandemic has delayed the reopening of schools here in the country, as well as Korea's college entrance examinations, which are now set to take place on December 3rd.
2010학년도 신종 플루 수능 대책 때보다 훨씬 강화된 방역 기준을 적용하여 철저한 방역 대책으로 2021학년도 수능을 준비할 것입니다.
These high school seniors are busy preparing for their college entrance exams, which is set to take place exactly a month from now. The rigors of their academic pursuits have been made even more difficult due to the COVID-19 pandemic.
요즘 공부하면서는 마스크를 쓰고 공부하는 게 제일 어려운 것 같아요. 그 산소도 잘 안 통하고 해서.
올해 계속 등교 개학과 온라인 수업을 번갈아가면서 했었고, 그게 사실 학생들이 빨리빨리 적응해야 되잖아요. 그런 거 변하는 상황에. 그런 거에 적응하기가 빨리빨리 저를 바꿔야 돼서 그런 게 힘들었던 것 같아요.
Schools here in Korea were closed on many days due to COVID-19. And even when they reopened, students had to wear a face mask and be mindful of their distance with others. In spite of these challenges, a sense of relief has washed over the students, knowing that their college entrance exams will be held this year without any further delays.
그 시험장에 못 들어갈까 봐 걱정을 많이 했었는데 이번 방역 지침을 보고 나서 열이 나도 코로나가 나도 어쨌든 별도의 공간에서 수능을 볼 수 있구나라고 생각해서 안도감이 들었습니다.
All test takers must wear a face mask, while social distance will be maintained by installing partitions and limiting the number of students at the exam sites. Students will be checked for any symptoms before they're allowed in, and those showing symptoms, as well as students who are in quarantine, will still be able to take the exams at a separate facility. School teachers are also doing their part to calm the students down and to make sure they feel safe.
지금 정신적인 부분에 대해서 안정감을 주기 위한 행동들을 많이 하고 있고요. 할 수 있다라는 자신감이나 이런 부분들을 계속 불어넣어 주려고 노력하고 있습니다.
Amid all of these changes, many students are finding themselves in uncharted territory.
평소 접해보지 않았던 가림막이 설치가 되기 때문에 굉장히 수험생들이 좀 불편하고 어떻게 보면 좀 시험 자체에 영향을 줄 수 있을 정도로 조금 부적응을 할 가능성도 있습니다.
In light of concerns of a renewed COVID-19 outbreak on the eve of the exams, all schools and private academies will switch to remote learning for the week leading up to exam day.
이 낯선 환경을 익숙해지기 위해서는 일단은 환경을 동일한 환경으로 좀 만들어 놓고 지속적으로 훈련을 좀 해야 되는. 근데 올해는 특히나 이제 동선 확보를 위해서 좀 이렇게 거리두기도 할 거기 때문에 예년보다는 조금 더 이르게 고사장에 좀 도착해서 마음가짐 좀 준비를 좀 하고요.
Korea's first CSAT exams of the COVID-19 era will not only be a stern test of the students' academic abilities, but also that of the nation's capacity to contain the pandemic.
Over in Pakistan, a resurgence in COVID-19 there saw 1,123 cases on Monday, the highest in 3 months. For more on the situation there, I have Asad Hashim live on the line. Hello again, Asad.
Hi there. Thanks for having me.
Right, Asad, what appears to be fueling the latest surge in cases over in Pakistan?
So I think Pakistan is seeing very similar conditions to what you're seeing in many other countries, which is a combination of two factors. One is the fact that there is a great deal of fatigue among citizens with the social distancing rules, with wearing masks, and all of those measures that people must take. And the second is that the economy has been almost completely reopened now. With almost every business and every form of office and industry reopened. Now, all of those businesses and industries have been told to reopen under certain standard operating procedures that are meant to enforce those social distancing guidelines within those offices and those enclosed spaces. But what we've seen is very weak enforcement of that. And so that, coupled with the fact that people are no longer taking the virus as seriously as they were before, or even if they are taking it seriously, they are not necessarily feeling willing to follow up with all of the measures that they need to take. That's leading to that rise. And I think the problem has also been that Pakistan saw its surge in cases, or its spike in cases, in June. And since then, the cases were steadily coming down up until around about mid-September. That saw the public in general start to take the virus not as seriously. And in Pakistan, as we know, in other South Asian countries, the mortality rate, the case fatality ratio has also been relatively low. And that's also led to a certain lack of seriousness on the part of people, it seems.
I see. Asad, how are authorities responding to this latest situation? What are the chances of a second lockdown there?
So there is, in fact, the government has taken strong note of the sharp rise in cases that we've seen. As I mentioned, cases have been rising since mid-September, and in the last few days, we've seen day by day the highest case rises we've seen in the last 3 months or so. We've also seen, because Pakistan is not testing at a very high level, yesterday there were only about 26,000 tests that were conducted. So Pakistan's test positive ratio has gone from hovering about 1.5% to now hovering close to, it was 4% today, which is quite high. The country's health minister has declared that the second wave has now arrived in the country. And today in the capital Islamabad, there will be a high-level meeting chaired by the Prime Minister Imran Khan, where they will discuss what measures to be taken next. As of a few days ago, they have announced stricter measures and regulations in terms of making public mask wearing mandatory, as well as asking all businesses and markets to shut down by 10 p.m. That has not really been enforced to date, and perhaps what we'll see after today's meeting will be a stricter enforcement strategy on the part of the government. If these cases continue to rise, as we would expect them to do in the current environment, I would say that the chances of a second lockdown are imminent, although this is something the government has shied away from in its strategy so far, because the economic costs of a lockdown in a country like Pakistan, where many live below the poverty line, are quite high.
I see. Asad, now amid those concerns, I hear that protesters have been taking to the streets with a number of grievances, including those against Prime Minister Imran Khan amid worsening economic conditions in the country, of course, and those against French President Emmanuel Macron, who spoke of understanding the shock over caricatures of Prophet Muhammad, but denounced the use of violence in response to these cartoons. I believe these remarks were made during an interview this past Saturday with your station.
That's right. So we've essentially seen three different forms of public demonstrations are now happening. And as you know, public demonstrations during the time of COVID-19 are a dangerous vector for this virus, which is extremely contagious to be able to spread, especially in a condition where you don't have many people wearing masks. I would say probably I've been observing and reporting on these protests, maybe 20 to 30% of the people who are present at these protests, where there would be thousands of people, are actually wearing masks. So what we're seeing is we've got the protests against the government of Imran Khan that are being organized by the political opposition. We have the protest against the comments by the French President Emmanuel Macron. And then we also have, as of this week, the government has announced that they will be holding their own protests in support of the government and against the political opposition. So essentially what you're having is these gatherings of tens of thousands of people not wearing masks in very close proximity with each other. And this also sends a mixed message to the public, because the government is on the one hand telling people to take COVID-19 extremely seriously and to wear masks and to maintain social distancing at all times. And on the other hand, just a couple of days ago, Prime Minister Imran Khan was addressing a rally in the northern city of Gilgit, where there were thousands of people packed in together and almost none were wearing masks.
Right. Asad, you've mentioned that you've been covering the pandemic and the protests as well. Are there any aspects of COVID-19 that you and your station have been seeking to highlight?
So I think there are basically two lines of inquiry when it comes to this pandemic in a country like Pakistan. The first that's been particularly interesting has been, as I mentioned earlier, the case fatality ratio in South Asia in general and in Pakistan in particular has been relatively low as compared to many other countries. And so over here, it's around about 2.01% as of today. And in fact, given the low testing rates, that means that the fatality rate is probably far lower in reality. And so trying to figure out what the reason for this is. Is Pakistan getting a weaker strain of the virus? That doesn't seem to be very likely, because the virus is obviously coming from other countries. And so the same virus that came from the US and from Korea as well, from China and other places, came into Pakistan. So the virus is the same. So what's causing that? Now, when you talk to epidemiologists about this, they're quite reticent, because they say, you know, science doesn't work this quickly on such questions. So we'll have to wait 2 or 3 years. The other line of inquiry has been obviously the pandemic is not just about the virus itself, but the effects of the virus has on processes around it when you put in social distancing or when you put in lockdown. And so we've been reporting quite heavily on, in a country like Pakistan, where people live quite low, many people live quite close to the poverty line. What effect does social distancing, what effect does a lockdown have on their lives and on their educations, for example, where schools here were closed for almost 6 months?
Right. Asad, one final very quick question before you go. Now, there have been reports of a rise in polio cases in Pakistan amid the pandemic. Can you tell us a bit more about this?
So polio is a neurodegenerative disease that causes paralysis of the limbs amongst very young children. You can only get it when you're a young child, I believe below the ages of 5 years. Pakistan and Afghanistan are the only countries in the world now where this disease remains endemic. Pakistan has been carrying out a widespread vaccination campaign to try and wipe out the disease as part of a worldwide campaign to eradicate this disease for good. Now, that requires very wide coverage and essentially a door-to-door campaign across the length of this country. 220 million people and with 39 million children under the age of 5 who are the targets of this vaccination campaign. Now, the last national immunization drive was held in February, and then in between from February to September, they were not able to hold the drive as they required to do so because of the lockdown measures and because it was simply not logistically possible or possible due to the COVID-19 pandemic. What that resulted in was essentially a resurgence in polio cases as those vaccination days were missed. The good news is there was a national vaccination day in late September, and that was held successfully. They met very close to their target of about 39 million children. And so the hope is that now those cases will begin to come under control again. But already we've seen 80 cases of polio reported this year. There were 147 in the entire year last year. And this year they are expecting it to be a similar number. So unfortunately, this year, which was meant to be a year of them really gaining control over that virus again, it seems to have missed that target due to the pandemic.
Right, that's quite unfortunate. All right, Asad, as always, thank you very much for making the time to join us live with your very informative insight.
Thanks very much for having me.
동절기에 접어들면서 실내 활동이 증가하고 불충분한 환기로 코로나 유행의 확산 가능성이 큰 상황입니다.
Right, we've been ushering in lower temperatures in recent days, and authorities are urging people to bundle up given the heightened concerns over the seasonal flu amid the ongoing pandemic. Now, for more on the weather factor and the revised social distancing guidelines, I have Professor Chung Gi-seok from Halim University. Welcome back, Professor Chung.
Good afternoon.
And I also have Professor Kim Moon-gyu, Director of the Global Development Center at the Yonsei University Health System. Hello again, Professor Kim.
Nice to meet you again.
Professor Chung, there have been concerns that colder temperatures would or could aggravate the pandemic. Could you start us off with perhaps the talk about a relationship between COVID-19 and the weather, if such a relationship exists?
Yes, it exists. The COVID-19 virus is behaving like a respiratory virus. The respiratory virus are more easily to proliferate during winter season, such as influenza, parainfluenza, rhinovirus, all common cold viruses. So it is clear that the COVID-19 virus will behave like that during winter season. So we are sailing through a very dangerous season these days. The reason why the cold season is more prone to catch cold is decreased humidity. And cold air leads to mucosal dryness. And the dried mucosa can be more easily hurt by any kind of pathogens. So that's one of the reasons. And the other one is during a lower humidity environment, the droplet shrunken and can be changed to aerosol. Then the aerosol go farther and stay in the air longer. Then that's another source of infection. And during winter season, people get together in a very close space, and they can transmit the infections more easily.
I see, which is why health authorities are talking about the importance of wearing face masks
Right.
indoors. I see. Meanwhile, Professor Kim, for the sake of our viewers, could you clarify the symptomatic differences between COVID-19 and the seasonal flu?
Well, we have to compare common cold, influenza, and COVID-19. It's something not easy, but if I say in simple way, everybody knows that common cold has symptom of coughing, runny nose, and sore throat, maybe fatigue. But influenza usually starts abruptly and fever for more than 3 days. And people complain about headache or muscle ache or something like that. And you may have some respiratory difficulties. And children's, they have vomiting or diarrhea. But if you have COVID-19, you might have the symptom even though you were exposed 2 weeks ago. And because that virus causes neuronal inflammation, you might have some change in the taste or smell, and even some hearing problems also. And nausea, vomiting might happen even in adults. So I would like to put emphasis that if you have some symptom like chest pain, difficulty in breathing, or weakness, it might be a blue lips, it might be an urgent sign. So I recommend people having these symptoms visit the hospital as soon as possible.
Right, to get themselves tested, right?
Yep.
Professor Chung, based on what you said earlier then, if those living in conditions that are cold and dry are more prone to being infected by COVID-19, would it be reasonable to assume that those residing in areas that are warm and perhaps humid or wet are less likely to be exposed to the virus?
Yes, I suppose so. But if you look at the countries in Asia, like Vietnam and Thailand or Taiwan, they are doing very well. But in the similar area with hot environment, Indonesia, Malaysia, Singapore, the confirmed cases are very high. So there are another factors apart from hot weather. So those are the burden of virus from the beginning. If you have a large amount of virus at the beginning, then you cannot do even with the warm weather. So that's the main reason why two different groups we see these days. And on top of that, government quarantine policy is another very important factor.
I see. Professor Kim, what would you propose as preventative measures to protect ourselves from COVID-19, the seasonal flu, and even the common cold as we head into the colder months of the winter?
Yes. Yeah. I think everybody has their own way to prevent that, but personally I recommend to have yourself hydrated and avoid dryness. So keep the humidity as good as possible. And because we are entering the winter season, I recommend people to have some vitamins, especially vitamin D, without additional calcium, because if you take it together, you might have excess calcium. So I recommend to have vitamin D. And we should continue our efforts to keep our hand hygiene and mask and avoid gathering too much. Since I see some patients coming to the hospital not realizing they're having fever, I recommend people to check their body weight temperature at home regularly. And if you belong to the high-risk group, get vaccinated. So conclusively, I would recommend people to be proactive than reactive.
I see. Are you recommending vitamin D to boost our immune system?
Well, it helps for the bone, but also strengthens our immunity. So at least in winter time, I think it's recommended.
I see. Professor Chung, speaking within your capacity as the former head of the Korea Disease Control and Prevention, what are your thoughts on Korea's revised social distancing guidelines that were announced this past Sunday?
Yeah, we have 3 days left and 4 days statistics. I guess we'll be staying at level 1 as of 7th November because all the figures are under the guideline. So during Metro Seoul area, we have only 50 or 30 about, and the other area less than 30. So I think we'll be starting with a new social distancing level from 1, but I'm afraid we should be upgrade maybe in not distant future.
I see. Professor Kim, there are concerns that Halloween celebrations this past weekend may have sparked a fresh outbreak. And if this is true, when do you suppose will we see them in actual numbers?
Well, I don't know exactly, but at least a week. And since most of the symptoms starts about 4 to 5 days after exposure, that's going to be a critical period. And whether the people in Halloween stayed indoors or outdoors might be another factor, because if you stayed indoors, you might be more exposed to the virus. And as I compare with Chuseok, Thanksgiving, Thanksgiving was more like a family gathering, and this Halloween is more like a gathering with friends, and they might have some alcohol consumption. And everybody knows that alcohol itself is inflammatory, and if you take too much, it might compromise immunity. So we have to see a little bit cautiously. And since we are approaching the end of this year, there's going to be a lot of gatherings because of the holiday, and I would say that smoking too much, drinking too much might be very dangerous. So I wish that people will consider that risk factors.
Right. And as Professor Kim has mentioned, Professor Chung, a lot of people will be gathering indoors to mark the end-of-year celebrations, of course, and authorities have highlighted the importance of wearing face masks indoors. How effective are these face masks when worn within close contact indoor settings?
I think it works, and it should work, but it varies depending on the situation. When you're in a concert and when you're in a movie or a musical, then you just wear a mask and watch the scenery, watch the view. Then that's it. Then you can protect yourself and others. But when you're in gym or in a karaoke, you have to take off the masks sometimes. Then it enhances the infection. So I don't think it applies to all, but from time to time, from place to place, you should think about. Then if you think it is dangerous, then you should not go there.
I see. Common sense would work wonders then. All right, Professor Chung, thank you very much for your thoughts. And Professor Kim, as always, thank you for being with us today.
Thank you.
Right, well, that is all the time we have for today's coverage of COVID-19. Tomorrow, we touch upon the presidential race over in the US amid the pandemic. And for voters in the US heading to polling stations as we speak, do have a safe trip. And for the rest of our viewers, do take care and see you tomorrow at this hour.
Almost a year into the COVID-19 outbreak, face masks have become a daily necessity. Yet despite the risks involved, some people are still not following the guidelines. To make the current quarantine system more thorough and effective, the Korean government has made it legally mandatory to wear a face mask in public places.
Mandatory mask